Hello, everyone. My name is Ruth Fiddler. This EpiMedia report is provided for HHPH587-01W 587 Epidemiology for Dr. Elizabeth Washira for Texas A&M University Commerce. This EpiMedia topic is based on Candida auris, which is a deadly nosocomial acquired fungal yeast infection that was reported on March the 20th, 2023 at approximately 4:57 p.m. Pacific Standard Time. What is Candida auris exactly? Candida auris is a nosocomial or hospital-acquired, healthcare facility-acquired Candida antibiotic-resistant fungal yeast infection. This is found throughout facilities in the United States, in almost half of 50 of the United States. C. auris is found in our natural biome, such as on our skin, in our body, living on surfaces that are in our everyday lives. It's considered an opportunistic infection for immunocompromised patients. C. auris lives on plastic and rubber tubing for IV and urinary catheters, central lines, and other medical devices like heart, LVAD, and ECMO tubing. Healthy patients usually are not generally at risk. C. auris is an invasive fungal yeast infection that colonizes opportunistically and is difficult to control when outbreaks occur within healthcare facilities. Chronic untreated fungal yeast infections like C. auris can circulate into the body and affect the brain and the central nervous system, which complicates treatment and treatment options and can result in death. So far this year in 2023, there are 12 cases that are reported throughout Missouri hospitals, and 4 of those infected patients resulted in death. In 2019, CDC reports 59% of all infected cases, which was equivalent to approximately 756 reported incidences, has spiked to 96%, totaling 1,471 incident cases in 2021. All immunocompromised patients are at highest risk. That's because C. auris is no respecter of age, race, ethnicity, persons. It only affects elderly, cancer patients, transplant patients, and other immunocompromised individuals, such as individuals who may be living or dealing with HIV or other infectious diseases. C. auris is a multi-drug antibiotic-resistant fungal yeast infection reported by CDC, NBC DFW, and doctors that are in the interview in the video. The experts advise that it is not as serious as MRSA, which MRSA stands for methicillin-resistant Staphylococcus aureus, but it is extremely difficult to treat. Prevention of C. aureus is done through due diligence from healthcare professionals, where they focus on prevention before it even occurs. Prevention can be provided through cleaning and disinfecting the environment, the tubing, the catheters, and devices, and making sure that the patient is clean and sterilized, and practicing sterile technique. Regular changing of tubing, catheters, and devices where applicable, and practicing good hand hygiene, such as washing hands in between patients, replacing disposable gloves, and again, using sterile technique. Public health professionals can raise awareness through educating the public and healthcare professionals to focus on mitigation of nosocomial infection control and prevention. Healthcare workers should be mindful of their due diligence to wearing their proper PPE, practicing, again, good hand hygiene and sterile technique practices, and catching signs and symptoms that the patient may have early on. The patients and the public should complete their full course of antibiotic therapy as prescribed by their doctor, even if they are feeling better. This helps prevent certain diseases that do respond to antibiotics to keep them from reemerging as stronger and evolved diseases that would otherwise be antibiotic resistant. Fungal yeast infections may respond more efficiently to topical or oral fungal treatments instead of antibiotics, and overprescribing of antibiotics where not applicable should be avoided. The topics for discussion today: Most people go to the hospital to seek medical treatment for their ailments. They don't expect a hospital to contribute to their illness or untimely death. In general, a healthy individual may not need long-term catheters and tubing, and immunocompromised individuals who seek medical care have the highest risk. Does the idea of developing a nosocomial infection like C. auris in a hospital setting increase your patient-provider distrust? Would a nosocomial infection potential like C. auris cause you to delay or fear seeking out your own medical care in a U.S. hospital setting? If you'd like to learn more about C. auris, here are some references that I used. Thank you for watching this presentation on C. auris, the deadly fungal bacterial spread that was reported by the NBC DFW Channel 5 News from the CDC alert. If you have any questions or comments, you may contact me, Ruth Fiddler, at rfiddler@leomel.tamuc.edu. Or if you'd like to reach out to our course professor, Dr. Elizabeth Washira, she'd be reached at elizabeth.washira@tamuc.edu. Thank you for watching.